Welcome to the Carsey Research Seminar Series. This is the second in our series for the spring. And we have one more this semester, which is going to be on April 28th, and that will be Tom Shapiro from Brandeis. So we hope to see you there as well. So today's speaker is David Finkelho, and I'm very pleased to be able to introduce him. My name is Sally Ward, and David and I have been colleagues in the sociology department for a long time.
You don't get any better.
Well, that's what I was going to say about you. So I think it would be fair to say that no one captures the power of good research informing policy better than David Finkelho. So we're very pleased that he's part of this seminar series. David is our own. He's here at UNH. He's the director of the Crimes Against Children Research Center and co-director of the Family Research Lab and professor of sociology at UNH. For over 30 years, David's been studying child victimization, child maltreatment, family violence, child sexual abuse, and issues that are related to that, all about children, hence his Crimes Against Children Research Center. He's published prolifically. He's a very prolific writer. He's published 11 books and over 150 articles and book chapters. That's actually probably an underestimate because he publishes so quickly that it's hard to keep up with everything that he's produced. So I counted the articles just for this decade, which is not even half over. He's published 40 articles, so he's clearly not one to slow down, which we're very pleased about. David has won awards locally, nationally, and internationally for his important work, and his work has been supported by funds from many agencies and foundations and federal sources, including the Department of Justice, the National Center for Child Abuse and Neglect, and the National Institute of Mental Health, among many others. And his most recent conceptual contribution is the development of a new field of investigation, something he's titled Developmental Victimology. And in recognition of his many contributions to UNH and the field, the university appointed David as a university professor in 2010, which is the highest award to faculty at the university for scholarship, teaching, and service. So that's something that he doesn't really blow his own horn about it a lot, but I want to make particular note of that. In addition to all of his accomplishments, of course, David is a warm, humorous, and supportive colleague and friend. And just a little side note, I should say, he also writes songs and plays musical instruments, and he performs those every year at the annual Family Violence Conference, which is sponsored by the Crimes Against Children Research Center and the Family Research Lab. So anyone who attends those conferences gets a big kick out of that. And I will leave it to your imagination to figure out what musical instrument he plays. So maybe he'll tell us later. Did you bring it with you? So it's an honor to introduce him, and his talk today is titled Trends in Child Welfare, Politics, and Policy. So, thank you, David.
That's very nice, thank you, really. And I'm very honored to be invited and to have you all come. I realize the competition at this hour is intense. I'm competing with the Red Sox opening game. I'm competing with Professor Larry Lessig from Harvard Law School, who's speaking right next door. Actually, forced to choose between me and him, I would have gone to him. But I was asked to talk about influencing social policy. I'm going to do that for a brief bit of time, and then I'm going to talk more about influencing society. And I am going to ask the question about whether there really is a strong relationship between social policy and what happens in society, with the examples that I'm going to give. But I'm going to start out with a story. Some of you may have heard me tell this story. My son, Nisha, is about to go off to college next fall, and I'm really experiencing this nostalgia for all the great times of parenting that we've had. And there's one particular flashbulb moment in my son's life. It was just such a wonderful thing, and everybody that I tell it to recognize. And it actually turns out to be a little bit relevant here. How many of you have ever been to the amusement park at Old Orchard Beach? Not very many people. I guess you don't. It's not a very fancy amusement park. In fact, it's kind of a little bit, it's a little run down. But for a 5 or 6 year old, it's good for some fun. And we used to go there a couple times every summer. I think this happened when he was about 5. And we went, and he'd ridden on some rides, and he wanted to get some cotton candy, which we don't eat in my family very often, but okay. So he got this big cotton candy thing, and we went to sit down at this picnic table, and there was another family on the other side of the picnic table with a girl about his age. And the mom in this family started to lay into this little kid. "You filthy little girl, you're getting it all over you. You disgust me. I don't know why I had you." And Misha had never seen, I don't think, a child being mistreated by their parents like this. His kind of eyes got wide, and he leaned over to me, and he said, "Dad, tell them who you are." And this is one of the most poignant moments of my fatherhood. I mean, on the one hand, my kid really gets what my life is all about. And on the other hand, my stock is about to take a huge nosedive. So I said, "Misha, I don't really think it would help." And he looks at me, and he nudges me again and says, "Dad, tell them who you are." I shook my head. And I saw him really thinking about it. He's a stubborn guy. So he leans across the table, and he says, "My dad is a family violence researcher." So he's now 18. He doesn't have quite the same high opinion of my authority that he had at that time, not just because I wasn't able to stop the abuse. But I feel a little bit like that, having been invited to this Carsey series on policy, simply on the inflated impression about my policy influence. Just tell them who you are, and it will stop. Now, it's true that I get my name in the newspaper a lot, but I don't think that that's really synonymous with having policy influence. And I think everybody, or most people, everybody sort of understands why I get my name in the newspaper a lot and why our research gets a lot of attention. And I think it's a pretty simple formula. Sex, crime, innocent children, or better yet, sex crimes against innocent children. Or, as I was thinking about it, maybe it should be sex crimes against innocent children with cute pets. I think we need to add the cute pets part. We'll probably be able to triple our coverage. I decided, based on that maybe I should be described as coming from the Rupert Murdoch School of Sociology. And I thought, well, maybe this would be a nice, let's see, is this big enough? You see? Oh, no, I didn't get, I already show how do I get back here? Let me go, slide 3. This is, playing with this is possibly a new logo for the Crimes Against Children Research Center. I frankly don't know whether studying other topics would have gotten the kind of attention. So I'm not sure that I'm a great person to explain just how to get. My colleague Ken, for example, gets a lot of attention on a very dry topic of demography. It seems to me has much bigger claim to knowing how to get people to pay attention. I will just say a few things, though, that perhaps are helpful in trying to get a few things that I've learned over the years. First, I have to point out that the biggest thing was the study with Murray Strauss. I've always thought that he was, Murray unfortunately is not here. He's going to the birth of his great-grandchild today down in Boston, which also is an understandable choice. I've also been able to surround myself with great colleagues who have certainly helped me. A lot of them are here, actually, and I appreciate all the support I've gotten from them. But here are a few other things that I think have been useful. One is to stay in touch with practitioners. And I've taken that so far as to marry two of them. I mean, not at the same time. But that has been extremely useful. I go to conferences where practitioners congregate. I listen to what they're talking about. I try and figure out things that might be useful for them. I try to formulate questions that will be of interest to practitioners and policymakers when I'm thinking about what to study. So that's one suggestion. I think in particular, I'd like to look for what I call wedge issues in research that will be useful, places where it seems to me that there is a debate, one that may be particularly roiling the policy or the practice community. One of the studies I'm most proud of was the study we did back in the 1980s about missing children. There was big controversies going on then about what the real nature of the whole missing child problem was. Were kids being abducted by strangers? Were they being abducted? Were they running away? There was a lot of confusion about what the numbers said, and we were able to do a study that helped answer the question that was kind of being debated at the time. Another trick of having influence, if I have any, is get in early. Try to see issues that are on the horizon, that need some study, that need some social scientific evidence for them, and cultivate them and see if you can bring. I've done that in a number of cases. I think I've done that on the issue of sexual abuse. I think we've done that on the issue of internet crimes against children. And one thing there's not a large literature that you have to study up on, and you're able to often say some very important things and set the terms on which people see something. And I think it's very, very useful for there to be good social science data early in an issue development. So that's another thing that I recommend. Another thing that I recommend is to, whenever possible, use agency data. Agency data is something that practitioners and policymakers relate to. They help generate it. They have to work with it. It typically references things that are going on in their domain. So, we have done a lot to, say, work with police data, and it's been very useful in trying to influence police. We've worked a lot with child maltreatment data, and that's been influential in talking to people in the child maltreatment field. So I think agency data, for all its flaws, has some very useful things if you're trying to have some influence. Write synthesizing reviews. So they're all, practitioners and policymakers are always looking for something that kind of sums up the state of the art. I really think that those that I've written have been very, very helpful to people, and I often get feedback about that. Create conceptual frameworks that are simple enough to use and complicated enough to get people out of their stereotype thinking. I've decided that the number 3 or 4 is really important here. People usually can think about on their own something that has 1 or 2 types, but if you have a conceptual framework that has 3 or 4 types, you've kind of expanded what people are kind of willing to think about. And these conceptual frameworks turn out to be very useful for the people who are involved in practice or policy, I think. The key problem, I think, for social scientists interacting with the law of society is to get people to think about things in a more complicated way, because reality is complicated. And typologies, I think, do that and give them a formal kind of reference point. So using your research to develop typologies, I think, is a very useful thing. Write in plain English and avoid jargon. I've really tried to do that. It was useful that got a lot of training when I was in high school writing for the school newspaper, and that really trained me up in using plain English. And I think wish we taught more of that in graduate school. And always include a good figure in every article you write, because figures really do speak a lot louder than words and are things that people kind of give people a strong sense of, a visual kind of take home for them to do. And I think that that's very useful for people who aren't used to thinking about numbers and kind of statistical relationships. So figure is really important. All right, that's all my wisdom. There's a lot more. I'll leave it to the other people. I do want to say that there was one mistake that I made early in my career that I think is a very interesting mistake, and my problem is that even knowing what I know now, I probably would have done it again, and this is what worries me. And this is that I pandered too much to the median practitioner penchant for alarm and urgency. I think it's just instinctually clear that people pay more attention to bad news than they do to good news. And a lot of people starting out, as did I, realized that if you emphasized the parts of what you were studying, or at least even allowed them to cherry pick, which they often would do without any help, cherry pick the statistics that were the most alarming and overstate them, or the inevitability of effects that were much more conditional, you would tend to get more publicity and have more influence. And it's not until I felt more established in my career, really, that I felt confident, I think, to call out people who misused my data in that way. And it's a real challenge, I'm afraid, that will affect some of the stuff that you'll see that I'm going to talk about now. So in my old age, as kind of penance for this, I'm turning over a new leaf, and instead of being an ambulance chaser, I'm a rainbow chaser. And I'm having a much harder time getting people to listen to me, but I find it satisfying in some way. All right, this computer is about to restart me, and if it does, I will be very unhappy. All right, so I'm going to talk some about what's going on in the whole child welfare area, and I think even some of you who have followed me along this this trail be somewhat surprised at what we're seeing, because it is nothing short of amazing. I'm going to start out with some data that I just got recently. This shows what's happened with juvenile offending behavior over the last 20, it's really 30 years. There has been an enormous decline since a peak in 1994 of about 60% in juveniles being arrested for all kinds of violent crimes. And it's a good 1/3 below where it was in the 1980s. Some of the specific crimes are even more remarkable. Let's see what I have to do here. Look at the statistics on juveniles arrested for forcible rape, down 72% since a peak in 1991. I think in 1991, I was working in this field. If somebody had said to me, what would you need to do to produce a near 3/4 decline in juveniles committing rapes? I would have said, well, you need a multi-billion-dollar program. As far as I know, there've been very little in the way of social policy in this area, besides the stuff that people do locally, like prevention initiative here and elsewhere around the country. But a 72% decline, and going, and still going. Motor vehicle theft. I put this one up just because the decline was so. But all the crimes are down. But motor vehicle theft, 86% decline in juveniles arrest. That's a very typical crime that is committed by a lot of young people who don't yet have cars, of course. But all right, so you know that crime is going down in general. This is for everybody. And I'm not going to go through all those details, just the picture there. But this one is interesting because it shows all these violent and property crimes in the dark bar, the data from the police, In the light bar, the data from the National Crime Victimization Surveys, which are population surveys of crime victimization. You can see really substantial declines in all of these crime areas. Interestingly, although it's down for everybody, it is down particularly for adolescents and youth. So you can see this isn't over the whole period. This is just really the last 10 years. So these are somewhat lower rates than you see when I put the whole time period up. But you can see that for all these crimes, the juvenile decline has been larger than for the adults. Then if we get into the child maltreatment area, we see similar kinds of things. Here is the substantiated cases of sexual abuse coming to the attention of child protection authorities. This is not just coming to attention, but having been investigated and substantiated by child protection authorities. 62% decline, a 2% increase in the last reporting period, but overall, huge decline. This has been substantiated by a number of other data sources. I just put this up here. This is from a kind of validation study that's done every 10 years, just because you don't know whether the stuff, there could be changes in reporting practices and things like that. This is national surveys of professionals in all kinds of walks of work around the United States, found a similar decline in what was going on in sexual abuse. This is from the National Crime Victimization Survey reporting on sexual assaults experienced by juveniles aged 12 to 17, 69% decline roughly over the same period. This is from another survey, Minnesota State Survey of every 6th, 9th, and 12th grader, asking about whether they were sexually abused at any time in their life. Because this isn't an annual measure, it's a lifetime measure, the decline isn't so dramatic, I think, because it's averaging over a larger period of time. But substantial declines in sexual abuse, that survey. Here's a survey that's done by the National Survey of Family Growth. Has a question about whether a young person had their first sexual intercourse with a person who was 3 or more years old, or large decline over this period of time. So lots of convergent indicators on the whole sexual abuse thing. Here's the physical abuse data. This shows also 54% decline in substantiation. This is the child maltreatment. This is the child welfare data coming from the child protection agencies. Here's the validation of that coming from the surveys of professionals using a systematic definition. Here's some of the survey data that shows declines. This is the Minnesota State Survey showing a decline in physical abuse. Neglect is a form of maltreatment that hasn't trended in the way that the others have. We're not entirely sure why. I'm sorry, Lisa Jones isn't here. She's kind of done a particular lot of work on this with me. But interestingly, starting in about 2005, 2006, we have begun to see a kind of much more, what you might say, systematic decline in neglect that may augur some movement like we see for the other forms of maltreatment. But I suspect what's going on for the neglect has to do with mostly a lot of definition, expansion, and contraction over that period of time. Another thing that we tend to be concerned about is kids exposed to domestic violence. This is from the National Crime Victimization Survey. Big declines in the intimate partner violence reported in that survey that young people would be exposed to. So you might expect from all that the situation in terms of foster care has been improving, definitely. This is the number of kids who are in, and the rate of kids in foster care, showing a 33% decline since the late 1990s. So a lot fewer kids are winding up in foster care. You might expect that a lot fewer kids are ending up in juvenile placements, in places like YDC and other youth facilities. And you'd be right, 45% decline between 97 and 2011 in the rate of kids who are in placement. This shows it broken down by ethnic group. That's nice to know because you're going to ask me that question later. These trends, actually, for almost all of these trends I'm talking about, don't show any a difference, or much of a difference, by ethnicity. Some of you who live in Horton have probably seen these. I actually posted them down by the elevator, and if you were bored, you might have had a little excursion. Been a lot of attention to the issue of, bullying and peer victimization, school violence in the wake of some of these episodes. Here again, the data show dramatic declines in a lot of that behavior over the same period of time. So here, a 74% decline in violent victimization in school. Some other school indicators: fighting on school property from the Youth Risk Behavior Survey, 26% decline during this period. Experience of theft victimization at school, 82% decline in that. So I've been making all of this up. Are you relieved? I know, people find it hard to believe. They want me to be making it up. But I'm not. Well, I know that some of you are concerned, so I have something for you here. Yes, arrests for child pornography have been increasing. This is based on 3 surveys that we've done. 2000, 2006, 2009, they're up 186%. Whether that means there's more child pornography in circulation, we don't know, but certainly law enforcement has been doing something to crack down on it. It does seem to be a growing problem in terms of the law enforcement end of things. But I'm afraid when you get beyond some of these really narrow topics of maybe involve technology or something, the good news is hard to take. The teen suicide is down very substantially during this period. It's leveled off a bit in the last 10 years, but most of the decline was down in the 1990s. But some of the survey stuff, for example, this from the Youth Risk Behavior Survey, asking kids about whether they thought seriously about attempting suicide, that shows a more continuing decline through 2009. But also very, a kind of convergent indicator on a similar issue. Missing children, kids who, that's been declining since about 1997, also down by nearly half. You want to look at the specific forms: running away, which is usually the largest portion, that's down over 50%. Family abduction is down. I want to thank Kay for having helped me put these slides together. She did a lot of the work on this. This is not true national data. It's taken from a number of state clearinghouses who publish this data. What about some other risky behavior? Here's stuff about substance use. Binge drinking by 8th, 10th, and 12th graders. About a 30% decline starting in the late 1990s, but during the 1990s. Here's a percentage of students who report driving after having been drinking. That's pretty reassuring. Incidentally, one of the things that I get accused of sometimes is being a shill and trying to do these subliminal advertisements for the New Hampshire Skiing Association. They look at these slides and they think, I better get out on those slopes. They're all downhill. Here's data from Monitoring the Future on drinking. I didn't calculate the trend here, but the actual change here. I just picked these up recently, but you can see the drinking alcohol is been down, cigarette usage is down. Now we get to some other risk-taking behavior. Teenage births. Isn't that a magnificent trend? 55% decline going back to 1991 in terms of teenagers 15 to 17 giving birth. And if you look at, in spite of the rap that young people have gotten, that they're engaging in promiscuity and high-risk sexual behavior, the survey data really don't back that up. Here's the percentage of students who had sexual intercourse with 4 or more people in their lifetime. This shows declines in that. Not huge declines, but certainly nothing that makes them look like the way they're often described in the media. Here's just the percentage who've ever had sexual intercourse. That's been going down. So, here had intercourse in the last 3 months. Modest decline in that over this period of time. This is good news too. Let's look at kids who drop out of school. 50% decline in school dropout. I was surprised. I hadn't heard that statistic. Had you heard that statistic? Yeah. Well, you're keeping it under your haystack, you guys in education. That is very impressive. And notice it's down for blacks and Hispanics. Maybe down more for the Hispanics. And there's been some improvement even in school performance stuff. I didn't inventory all of this. So what's going on? Well, I just want to, one other piece of information that's useful to have is this happening in other places as well? And one thing that when you begin to look for social indicators in other countries, it does make you glad to be an American social scientist, because there isn't that great stuff available for even some of our near and dear cousins in the world. But here's some data that shows that various kinds of violence and child maltreatment are down for kids in the UK. Here's some statistics showing a decline in sexual abuse for kids in Germany. Here's data that I found for New Zealand showing something of a decline there for child maltreatment. But I really don't have tremendously equivalent data. This one is interesting, a survey that's been done on 4 iterations in a whole lot of countries on the issue of bullying, which does show very impressive declines in bullying throughout most of the places that they were looking at it in the 1990s and early 2000s. And on the issue of teen pregnancy, there is some data that suggests that other countries have had declines in teen pregnancy as well as the United States. So we're not alone in that particular trend. Okay, this is just, I'm going to skip over that. It's just okay. So what's going on here? Well, to think about this, it seems to me we have to provide some kind of description for what it is we're trying to explain. We're trying to explain improvements in many forms of youth risk-taking, crime, sexual behavior, alcohol and substance abuse, improvements in the way families are treating them, less violence and hostility. And we've seen a phenomenon that, for the most part, was not reversed by the recession, or let's call it a depression, in 2008. A lot of these indicators continue to decline, even at a time when I think many of us were kind of worried that it might reverse. We don't find any obvious differentials in these indicators by region or ethnicity to speak of, so you can't say that this is primarily happening among African Americans or in the South and the West. And there do seem to be some international parallels that suggest that maybe something, whatever is going on, is something that is going on in other places as well. So what are the list of possible, and I regard this as one of the great social science whodunits of our era. And I think that we should be really trying to figure this out. I was originally taken with the idea that economics had something to do with this. And the time when a lot of these trends started out and we saw the biggest declines were in the 1990s, which you may remember back to nostalgically as the time of the longest kind of domestic growth period that we'd had in, I forget how long, maybe ever. And there, was a better economic betterment for a lot of people. So it made sense that some of this, what we're seeing, was connected to that. But then everything, turned for the worse. And if you look at this, you can see, the poverty went back up to pretty much where it had been in the early 1990s. A lot of the social safety net was cut out. This is the way in which support for families and kids, the AFDC and TANF stuff has kind of dropped off the map. So it made me think that I don't know that the economic explanations are real. Maybe they potentiated something, but I think something's going on here that is much deeper than economics. All right, what about family factors? Is there anything going on in the demographics or the family structure? Because we know that that's really pretty tied to child well-being. Well, hard to sort of find a smoking wand here. If you look at the living arrangements of children, you see those living with in single parent families has gone up, and those living with two married parents has continued to decline throughout this period. So it's not like you can find some family structure thing that really corresponds with what we're seeing. This is, I think, particularly impressive, and I didn't. The amount of homelessness and kids living in kind of stressed living situations has increased. This only goes back to the 2004 period, but this shows a pretty dramatic increase during a time when a lot of these indicators were ameliorating. So, these stressful things that we think of in children's lives, something has kind of overwhelmed them. Here are some other things that I think are probably not very good explanations. The criminologists who've been focused primarily on the damn homicide rate, which I think, it's such a small and localized thing, it's really not a good indicator of what's going on, I think, in the society as a whole. But they made a big business about the crack cocaine epidemic that took off in the 1980s, and then the rationalization of the drug markets, and the falling out of favor of crack cocaine. And that probably had something to do with what was going on with the homicide rate, and maybe even the juvenile homicide rate. But it doesn't explain, why kids have been bullying each other less. It doesn't explain, why a lot of these other indicators that we've been seeing. Gun control. Well, I don't think really that much has happened on the gun control front, but that might be useful in the homicide debate, but not in explaining why sexual abuse has declined. Incarceration. Well, there may be something to some of the incarceration. We have put a lot of people behind bars, and there are some criminologists who think that has played a role in the overall crime drop. But it's hard for me to see how this is really affecting much what's going on with the juveniles. I mean, we see declines in school violence. It's not because we're putting kids that age away in large numbers. That's not happening. There've been all the social policies in the area of protecting kids. There's been all these kind of name laws, Megan's law, Jennifer's law, Amber's law, these laws aren't doing much. And all the evaluations of them show that they're not doing much. But more than that, they got started late. These things didn't come into effect until the late 1990s. A lot of the improvements had really taken a hold well before these kinds of social policies came into effect. This is the one that I most often hear. A lot of people have read Freakonomics, and the University of Chicago economist Steve Levitt is his name, I think. Has a chapter in that book where he claims that crime went down because in 1972 abortion was legalized, and after that the generations were purged of their unwanted children. And we know that unwanted children are more likely to grow up to have problems and be delinquents, and therefore these cohorts would start to look a lot more well behaved when they reach their majority around age 17. Oh, that's around 1990 when you begin to see this kind of stuff happening. And he did a few statistical calculations that showed some promising correlations, although they've been disputed by other people who looked at it a little bit more rigorously. My big problem with it is twofold. One is crimes went down starting in the 1990s for people who were well outside of this cohort that had been purged of its unwanted children. I mean, guys in their 30s and 40s and who stopped abusing kids as much, and they weren't part of that cohort. The other problem that I have with it is we should have, if this were truly a cohort effect, we should have seen improvements in the lot of children starting much earlier, starting in the 1970s and 80s when those kids were young. More wanted children are better treated by their parents as well, in theory. That's why they become less delinquent when they're adults. But we didn't see those improvements in the maltreatment indicators. Child maltreatment indicators continued to worsen throughout the 80s. This looks much more to me like what we call a period effect than a cohort effect. People starting to behave better in the 1990s altogether, and not something that was just pertaining to young people. And that's why I'm not that crazy about abortion legalization as an explanation. And it's also why I'm not so keen on this environmental lead explanation either. That's another cohort effect explanation, the idea that we started to get lead out of products, gasoline and paint in the 1970s. We know that lead toxicity affects cognitive development. It's connected to delinquent behavior. You get it out of the pipeline, then you have kids who grow up and become less delinquent. But similarly, we don't see the cohort effects quite that I think that would show in terms of reduced child maltreatment, in terms of doesn't explain what's going on with the adults as well. You can see I don't have the answer here. I'm throwing a lot of stuff out, and I'm kind of giving you my best thinking about it, and then I'm going to let you go at it, and maybe you've got a much better idea than I do. All right. Here's my suggestions for what we should be looking at if we're going to be looking for smoking wands. I think that there is a possibility that we started to do stuff that was more effective. I'd like to say social science might have had something to do with that, but it may just have been cycles of reform and self-criticism. But I do think that we've got a lot more programs that have been empirically tested that seem to have some effect, that have been taken to scale. We do have a prevention science that thinks more critically about these issues. A lot of new programs have been developed to address all of the problems that I've been talking about here: delinquency, suicide, running away, alcohol and drug abuse, maltreatment over the last 20 or 30 years. And it's plausible. The problem here, and I'll come back to this a little bit later, the problem here is that when you look at the evaluation literature on these programs, the effect sizes tend to be modest if they show effects at all. And what's really, I think, the paradox that social analysts need to explain is how we're getting these really big improvements from these programs that show to be so kind of marginally successful. But I think that I think that it is a really plausible thing to look at. Now, one of the social innovations, though, that I think personally might be very worth studying has to do with psychiatric pharmacology. Prozac was authorized for distribution in 1988, and shortly thereafter, the number of prescriptions that were being written for psychiatric medication really took off in a dramatic way. And let's see if I think I actually have a slide here that shows this. This shows, for example, a doubling. This shows office-based medical visits of young people. But what was mainly driving this was the prescription of psychiatric medication. And it's now estimated that well over 10% of adolescents are taking some form of psychiatric medication, I believe, or close to 10% are taking some form of psychiatric medication, or have taken some form of psychiatric medication. And two of the, I think, very important things about psychiatric medication is that it is a form of treatment or intervention that men are willing to access, men who don't particularly in general like to go for talk treatment, and that lower socioeconomic people find acceptable because they don't have to go see a shrink. They don't have to feel stigmatized by the issue. They can simply go to their primary care physician and get a prescription, which is how most people get their psychiatric medication these days. And it seems to me possible that, when you have large segments of the population taking medication that can help relieve disruptive behavior, that can relieve anxiety, that can relieve depression. These are things that are at the root of many of the kind of adolescent behavior problems and some of the child maltreatment stuff that I'm talking about. So it does seem to me that there is a nice causal connection between the expansion of the psychiatric medication availability and some of these really big declines that we're seeing in all these social indicators. All right, I got a few more things though. I do think that we did have a troop surge. One of the big markers was when Bill Clinton in the 1990s hired 100,000 more police officers. But at the same time, lots of the states were hiring many more child protection workers. And, the number of people being hired to do child welfare kinds of things has really increased dramatically during this time. So you got a lot of people who are out there doing pacification, you might call it, if you want to continue the military analogy. And some of the things that they've been doing, I think that particularly the whole policing area has changed a great deal. The way in which police go about dealing with social problems has changed incredibly. The police have gotten a lot more socially sensitive. They have people who are trained in domestic violence, trained to talk to children, trained to talk with suicidal people, and so I think it's possible that with the number of these new troops that we've got there and having different techniques that they're using, they could be having a broad impact on a lot of these social indicators. They live in schools now. Many schools have school resource officers who are there and who've been trained in a lot of these prevention techniques. Nobody's ever really evaluated it, but it's plausible to me that they've had some impact on adolescent behavior. Technology and surveillance. Now, this is an interesting one that I just sort of started to think about recently, but the women, I think the women responded to this much more. When did you get your first cell phone? And what were you thinking? Was it on your mind that that your car might break down on the way home, and you didn't want to be a sitting target there, and you wanted to be able to call for help? And the cell phone, you didn't know whether you would use it or not. But in some ways, this has been an amazing crime prevention device. It allows us to summon help. A teenager who's out in a situation where some sketchy things are going on, they want to get out of here, they can get help. They need some guidance about what to do in a situation, they can get out. But not only that, if I see something happening, I'll take a picture of it. And people know that they can be captured. Not to mention the fact that we have surveillance cameras all over the place. For me, it seems to me in some respects the iconic moment for our culture was when Richard Nixon got outed by his technology. Richard Nixon, I think, was the first classic case of somebody who fell in love with the technology and got caught committing a crime. And I think that that's emblematic of the deal that we've all made with the technology. We know that it affords us lots of wonderful things, social interactions and information, but we know that it also is tracking us. If I'm sneaking out on the side and going to see my mistress instead of going to the ASA meeting, it says that I'm not in San Francisco. So, have we decided that, as part of the deal, we need to behave ourselves? And so, we've seen a decline. Not to mention the fact that I think one of the big promoters of a lot of the youth social problems that we see is something that is so mundane as boredom. What is there to do around here? Let's go knock over a few mailboxes. Let's have a rumble. I think that the technology has really remediated the boredom problem. I think kids don't lack for things to do these days as long as they have their technology around. And I wonder whether some of that boredom that fed delinquent behavior is now no longer motivating it. And so we're seeing a lot less of this other stuff. Others of these indicators, the missing children's thing, that seems to me to be a no-brainer. Of course, missing children don't go missing if they've got a cell phone. If the parents don't know where they are, they call them up. So kids who used to be missing aren't missing anymore because the tether is there. So I think it does kind of tie into some of this. Finally, two things. Changing norms and awareness. I threw this in because I do sense that there is something that is also changing in the culture, and I don't know how important it might be, but I do think that just the level of awareness that we have about social problems, about family dynamics, I think when we see small effects from program evaluations, one of the possibilities could be that somehow there's a kind of cultural therapy effect that people who don't actually get the programs but are somehow getting through television or the newspaper or their friends, that something is going on there that is roughly equivalent to some of the stuff that people are getting in formal programs. But I don't know exactly how that works. But it does strike me that when you see all the places that people can get information about social problems, it may kind of be part of this decline. And finally, this is the one I'm least, maybe Ken will have some ideas about this. I think I've raised it with him a couple of times. But, there's that Rob Sampson article on the crime decline. And he's sort of argued that it might be the fact that we have many more. Much larger segment of our youth population today is of immigrant background or recent immigrant parents, and as a group, this may be a group that is highly motivated to get ahead, to play by the rules, keep their record clean, do well in school, whatever. They maybe have a fair amount of social support in that from their parents. Perhaps there's something about the immigrant. The problem here is that we don't see differential improvements in like some of the Hispanic groups for the most part. So I don't know whether that's something you would expect. All right, getting to the end here. Bear with me just a little bit more. After talking about this for a number of years, and really, I think the thing that may surprise you is, why haven't I heard about this before? I think we may be living through an era of one of the most dramatic, child welfare improvements that we've had, but nobody's talking about it. And so now, that was my surprise. But as I've talked to people about it, I'm really struck by how skeptical people are, how resistant they are to the idea that things. We may see this in the conversation here. People are going to pepper me with lots of doubts about this. You should. But you'll see, it's if I were presenting statistics on how everything was getting worse, you wouldn't see people peppering me with quite the same zeal. And I think that there are a couple of reasons why this is controversial. One is that I think a lot of people who work in this area simply don't see it. They continue to do their work. The clients continue to come in. The problem seems about as big, serious as it was before. And they say, you number crunchers, I just don't trust it. Now, I think this is maybe, it is true that maybe things haven't improved everywhere and for all communities and all problems, but I think that this is to some extent a form of clinical myopia. That when you are when you're providing some kind of service or doing some kind of consulting, you are in the field and your network grows. If you're doing a decent job, you're in touch with more people hear about you, somebody tells somebody else, another agency signs on for your services. Your client base is going to grow. So it is going to be hard for, I think, individual people to see maybe what is going on in the bigger picture. That would be the explanation that I would give. But then this is, I think, the real kicker, and that is that people are afraid of good news because they think it will mean that the policy support for these issues will disappear. That, that as soon as John Boehner finds out that juvenile crime is down, hey, there's a whole budget line we can cut. So, I've gotten people now saying to me, okay, I believe you, could you not say it so loud? This could be a dilemma, but I'm not sure that it's a dilemma. I do think that to some degree policymakers get tired of funneling money into something that doesn't seem to ever get better. There have been some people, I think the teen pregnancy people have done a good job. That's probably among the things that I talk about that people are most familiar with. They have actually done more to publicize those findings and get people aware of it. And I don't think, people have gone after family planning, but it's not because they're keeping teenagers from having kids or they're being successful at that. It's because, they don't like providing contraceptives they don't like them providing abortions, I guess. But I think that we shouldn't let this stand in the way. So, any implications from this? Well, I think one of the most important implications that I didn't put up here, but that I wanted to come back to, given the way I sort of framed this talk, is we have had a period where, this last 20 years, where I think the social policy people have felt very, very frustrated, if you talk to them. There is a sense that little has been happening, that, that policy has been stuck, that the funding is not there, that it's being cut, that these issues, and the issues of child welfare and all that, are not really salient to people. And yet, something really fantastic has been going on. So one of the questions it raises, what is the relationship between social policy and indicators? Are most of the things that are going on here actually things that we didn't anticipate, that we didn't predict, that we didn't really think about, and that a lot of the problem has in fact been taken care of by unexpected social forces? It seems to me, if that is the conclusion, and I don't know that it is, but if that is one of the conclusions that one draws, it seems to me that the strategy that you think about for dealing with social problems is very different than the one that you say, well, we know from our research here that X and Y is the thing that, it works, and so therefore we need to build a big program around that. I don't know what the exact strategy is if you sort of take this other perspective that unexpected kinds of social forces really turn out to be the ones that overwhelm things. But it does seem to me that you kind of think about social policy in a very different way. All right, why don't I just stop at that and see what kinds of questions there are. Come to our conference. right, I'm hungry for ideas, so. Yes.
I have trouble.
Oh, sorry, I'm sorry. I recognize him. I'll get you next. You'll be next.
Could you talk about any regionality that you have to the data, and might the forces of differences in a region correlate to changes in data if you look region by region?
Well, I've looked at some of the regional stuff, and it does not make any sense to me. You see some state differences in some of the rates, but they don't correlate. They don't correspond